Okay, quick video for myself, Harvey Goldman. No cuts, no edits, no filters, and no hair. So another glorious day. As you can see, sunglasses at the ready. Let's get into it. So for today's video, basically the NHS time bomb and why getting sick in the UK in 2025 is a huge financial risk. So in a nutshell, the NHS is absolutely on its arse. I know firsthand from having had a hernia for the last maybe 12 months or so. I've been put on a list. I was on there for 9 months. I got taken off that list and then put onto another list and was told that it'd be at least another 9 months if there wasn't another list after that. So I know that my situation isn't life-threatening. I know it's only a hernia. I fully get that. However, it's still ridiculous considering that I am still paying into the system. Now, the reality of this is that GPs' offices, they've been shutting down. Over the last 11 years, according to data, 474 GP practices were closed. So that's between 2013 and 2024. So the number of patients per GP, and this is per GP, not per office, is actually as high as 2,300 per GP. That's phenomenal. A&E wait times are the worst they've ever been, worst on record. Over 40% of patients are now waiting 4 to 6 hours, and that's a low ball. 4 to 6 hours just to get seen in A&E, where you go when it's a full emergency. There is a dentistry crisis, hence why I don't use dentists in the UK. Around 90% of NHS dental practices are now not taking new patients. In fact, many of them are just choosing to go private for most of their services and only dealing with NHS where they absolutely have to. There has been a bit of a surge in private healthcare. Just over 250,000 people. In fact, the actual figure, 272,000 people paid privately for treatments in 2024. Now, compared to 2022 and 2023, that's a rise of around 22% on those years. And check this, mental health support, something that's probably being pushed out more than ever now because it's almost fashionable to require mental health among some circles. The average wait time for NHS therapy is now around 8 to 9 months. And all of this without prescription charges going up to £9.90, which is basically another tax on being unwell. And there's a regional NHS lottery that you probably don't know about, where basically there are huge differences, and I mean gargantuan differences, in the level of care you get depending on your postcode. And if you think I'm lying, jump on Google and have a look. It's on the internet. It must be true. So the NHS, it's basically no longer free and equal for all. And that's the reality of it. Now, obviously, I pay for my own treatment. I have got private medical with Bupa. However, they don't treat anything pre-existing. I had a touch of tennis elbow, poor me. And they were kind enough to give me some physio for that. However, I had to jump through so many hoops, and it was only a couple of sessions. So compared to what I pay for that private medical each month, I probably could have just bought that treatment privately with cash, not gone through my insurance, and it undoubtedly would have cost me less. And as for dental, we know that there's no chance of getting seen reasonably priced in the UK. That's why more and more people are now going to Hungary, to Poland for things like general treatment. Or if you want the other side of it, where it's kind of aesthetic replacement, then it's places like Turkey or perhaps even Spain, I've been told, is very good for that type of thing. So how do we fix this? How does the NHS move forward? Why am I still paying these mammoth contributions from my taxes and things like national insurance and everything else into a system that's obviously having its funds mismanaged in such a bad way? Who's accountable for this? Where does the buck stop? Which arsehole, I'm going to say it, which arsehole is responsible for me having to wait 18 plus months to get a hernia treated? It's not on. And obviously something needs to change. It makes me jealous in some ways that America just has a system whereby you pay into it and that's it. And I know that's not going to work for everybody because there are people that can't afford it. There are people that are so ill, you know, their treatment would cost tens of thousands, and I completely get that. And having an NHS in the UK used to be a wonderful thing. It used to be the thing that made the UK awesome. The fact that we had an NHS system that had been around for all those years and actually worked. And it kind of feels that people have abused the system and taken from it and taken from it. And now it's just broken. I mean, is it even worth saving? What are your thoughts on this? How do we fix the NHS? Is it fixable? Is it just something that we might as well kick to one side and create a different system? Create a point system, a merit system, or something like that, where people get treatment based on perhaps, I don't know, how they live their life. So maybe, and this is just a bit of tinfoil hat thinking, maybe what if all the people that drink, that smoke, that have bad diets and make bad choices, what if they pay more for their healthcare? But then the people that don't, the people that take exercise, that don't drink, that don't smoke, that look after them, that look after themselves, what if they pay less? I mean, it's a system. Probably not going to be a very popular one, but there you go. There must be a better system than the one we've got where we're all just paying into something that gives us nothing back. I do feel that the NHS hasn't got long and it's probably going to fall apart anyway. There must be something in there that's worth saving. Anyway, let me know your thoughts on this. What's your experience of it? Are you, like myself, on an NHS waiting list? Have you been there for a long time? Are you optimistic you are ever going to get treatment? Or, like myself, is it just bump after bump after bump further down that list? Do you have family or relatives that rely on the NHS that couldn't do without it? Are you worried about what's going to happen to them if the NHS finally does crumble and disappear? Are there funds that you've got in place to cover that privately? Let's hear it. Anyway, YouTube's going to put another video there. Really interested to find out opinion on this one, so let me know. Remember to like, follow, subscribe, all that jazz. Another one tomorrow. Goldman, peace out.